Your major concern was one asymmetry is there, you remember? Your beard has grown now, so it will pain. Just keep your head back. I'll go slow. Fine? If the pain is too severe, I'll stop. I'll stop. Done. Okay. Done, okay? This will be a little easy. You see, the tape is now only on one side because your major asymmetry was on the right. Okay. Yeah, you still have a little bit swelling because your major concern was this asymmetry. Chin has come ahead, chin has become more prominent.
The inside stitches, how many days it will cure?
Inside stitches will take time, sir. Minimum 1 month, minimum. Even mouth will be. Inside the nose, inside the mouth, you need not remove them. Outside, you can. Almost more than a week over. Okay. You can hold the mirror and see for yourself, and we'll also show all these are sticker marks or tape marks, not looking very aesthetic right now. It will all go. Okay, now you can compare. All these are blue are the stitch marks. Stitch marks will take it out, like the stitches will take it out, so that will disappear. These are just the adhesive things. Okay, now that you numbness will be there, swelling is also there for you, because you see, you look at your chin from the side view. First foremost we'll see the nose. Okay, see the nose from the front view, see how it was. You can see even here you did not have too many specifications, but you clearly said that with the nose you have some breathing difficulty. You had, in fact. Right now, how's your breathing? Okay, yeah, and you see the dorsum has become narrow.
Again, the size will reduce from.
Yes, we have, because you wanted a tip which is little sharp. You wanted dorsal aesthetic lines which are very straight now. You can look up little bit. Yes, the only reason why you cannot see stitches here is because it's been done through a closed approach. But even a closed approach can give amazing superlative results, so as to say. In fact, this is closed approach with rib harvest for you, because augmentation was needed and septoplasty was needed for you. Why septoplasty? Is because you had breathing issues. So through a closed approach, Dr. Richardson has done a functional and a cosmetic rhinoplasty for you. Genioplasty, why? Because we'll see the side view. Total side view also is fine. Yeah, so we can see, yes, just turn on one side, you turn towards your left, then you can view. Yes, now that the beard has also grown, but you see that kind of chin you had earlier. Now your chin is prominent, your chin suits your face, because you have strong features in upper 1/3, middle and lower 1/3. So now the chin has been augmented both horizontally and vertically. Also, you had mild asymmetry in the jawline, so even that has been corrected with an angle osteoplasty. Swelling is there for you, tightness, numbness, everything will remain. It will take time for it to go.
These stitches will remove?
Yes, we'll remove it. We'll remove it now. How are you finding it? That's important because you were the one who stayed here, stayed here for almost.
This filling is there.
Yes, yes, right, right. Do send in your pictures because immediately when we take the tape off, swelling is there. So send in your pictures. It will only improve over the next 1 month. Okay.
Still nose is big one, you know.
Nose looking still. You see your nose earlier to show. Yes, you see how your nose was. You just look at this picture and see here. See how it was flat. It was depressed over here. It had no proper definition. Swelling is there, true, but even you look at the tip, see how flared the tip is. Your skin also matters, so your skin also is like not very thin, so as to say. Okay, we'll remove the stitches off and see as to how your results are before, like in due course as well in the coming months. Okay, thank you.